My name's Jeff Freiberg. I'm an assistant professor of medicine in the Division of Infectious Diseases at Vanderbilt University Medical Center in Nashville, Tennessee. And I work there as a physician scientist doing research in infectious diseases and also taking care of patients with infections.
I read your review, What's Hot in Infectious Disease Clinical Science, and there's a lot of important research that was covered. How did you decide which studies to include?
This is our second year putting together this type of review, and it really is challenging. We went through dozens and dozens of studies to try to pick the ones to include. I think for every study that we included, there was several other ones that you could easily have made a case to cover. Some of it was focused on things that fit together well into this review, and then some of it was trying to think about which studies would appeal the most to the broadest audience in infectious diseases. So we we focus mainly on clinical trials, particularly phase 3 trials, to include more of those into what we studied, but also not just including successes, but also some notable failures in studies that we felt were important to highlight as well. And then, of course, the difficult part is that each year the trend in terms of clinical infections and what we choose to highlight there changes. So that we had to kind of focus on what was the most present threats, the newest threats this year to focus in our kind of emerging infection section.
I guess then let's start with emerging infections, since that was just kind of the last thing that we brought up. I know that you mentioned that dengue cases are increasing in Puerto Rico. That was a big thing. So, how do you think that climate change, the rise in dengue infections, does this affect the United States? And do we need a stronger mosquito control plan?
Yeah, it's a great point. Definitely, climate change is going to affect a lot of things, and vector-borne infections in particular, as we can see the vectors in different places that they weren't presently. I think globally, dengue has seen some really high levels in the past year. And for the US, Puerto Rico, because of its location, is definitely the most affected. But we also saw some local transmission in the continental United States, and then plenty of travel related cases. I think the one of the biggest problems with dengue is the fact that we don't have great vaccine options in the US. Currently in the US, the only vaccine that's approved is for people who have had previous exposure to dengue, and so it's limited to people who are in endemic areas for that region. Fortunately, there are trials that have occurred testing new vaccines that don't require previous exposure, and so those have a lot of promise and hope for the future if this continues to be more of a widespread pattern, especially if we see changes in the distribution of where people are at risk.
And then moving away from the mosquito-borne illness, I know that we mentioned Mpox, avian flu, and measles in the piece. So those are kind of big three infectious diseases that have been emerging this year. What do you have to say about them in terms of vaccination, in terms of clinicians, trying to keep us safe from all three?
Yeah, they're interesting because they're all three infections that we have different experiences with, different levels of protection. I think that the rise in the case of measles is probably the saddest thing to see as an infectious disease doctor because we have a good vaccine against it and we've been able to prevent it and we know what we need to do to prevent it. And it's having high enough vaccination rates. Unfortunately, it's very contagious. So even with a slight dip in the rate of vaccination in the population, measles can take hold. But for there, the answer is really simple that we need to get the word out about how dangerous measles is, how rapidly it's spreading in communities, and increase vaccination rates. For Mpox, what we saw this year as opposed to a couple of years ago when we had widespread outbreak, that was clade 2 of the virus. This is clade 1 this year that we've seen. We had first case in the US in the end of 2024. It's definitely not as widespread. It remains to be seen with these clade 1 cases. The thought is that they're probably more dangerous, probably worse cases, but we do have vaccine options, vaccines against smallpox or Mpox are effective at least reducing the severity, if not preventing the spread of the disease. And so, there it becomes a matter of weighing the risk of how rapidly is it spreading in the population, who's at high risk and needs to be vaccinated. So at this point, the risk to the US is still low, but it's important that we have the available supplies and the knowledge out there so that people can get vaccinated quickly if it does become more widespread. The H5N1 highly pathogenic avian influenza is probably the most concerning case because of how widespread it is right now in both the livestock and bird population, both poultry and wild birds. And we're seeing some cases of crossover into humans. We don't have any clear cases of human to human spread, but it becomes a difficult task to try to vaccinate poultry populations, livestock populations to reduce the spread that way. And we don't have the same type of effective vaccines that we do for H5N1 that we do for some of these other diseases. So the real focus needs to be on developing better vaccines and developing better ways to control, identify cases prior to it starting to spread in the human population. So different challenges for all three and different solutions will be needed for all three.